Okay, so I'm presenting on swimmer syndrome. I don't have personal experience with this, but I have seen a lot of videos online of puppies like recovering from this, going under physical therapy, that kind of thing. So it is an uncommon condition that affects both young dogs and cats. It causes the limbs to splay outwards and move in a paddling motion, which you can see in this dog and this cat. It frequently affects the hind limbs of chondrodystrophic breeds of dogs, which are dogs that have short legs in comparison to their body size. So something like a dachshund, bulldog, that kind of thing. They cannot walk correctly, stand upright, and they do have difficulty eating. They may also present with a sunken chest, especially if all four limbs are affected. And I do have the video example.
Do you need sound or?
No, I don't need
Okay.
sound. So this is just the puppy that has the condition, walking, or trying to walk really. He's not moving forward very well. And then that's him in grass. So he has a little bit more footing, but he's still not walking very well. Okay. And then this picture is just to show an example for kittens. This is the swimmer syndrome kitten. You can see her legs are splaying out to the side, and then this is a normal kitten of the same age for comparison. Ultimately, the cause isn't known, and the condition may be hereditary or congenital. Possible causes include improper nerve myelination, poor development of peripheral motor neurons, delayed muscle development, infections, and possible environmental factors. These factors may include excess weight, slippery flooring, and high temperatures. One research a study that I found, they observed that the swimmer puppies were more common in small litters where the puppies had more of an opportunity to become overweight. It was easier for them to get their food. The disease typically presented around 3 weeks of age, which is the time where most puppies are learning to walk or are already able to walk correctly. And in this study, the flooring was not observed to have a significant effect on the occurrence of the syndrome. These are just some examples of treatment. There are many forms of physical therapy, and that can include taping the legs into the correct position. Once they're taped, they just stay under the body, and that allows the dog to build up muscle strength. So that's this picture right here. So massage and stretching of the affected limbs, a lot of the time they're very stiff and don't have a good range of motion. Supporting the animal with a harness while walking, which is kind of this picture, and there's other ones as well. Some that I've seen, they kind of put the dog into like a chute so it can be separated. Not separated. It's kind of held in place by like two walls, and it can walk in a straight line. Prognosis for these animals is good when the syndrome is identified and treated early with physical therapy. Animals with flattened chests are at a higher risk of, it's supposed to say aspiration pneumonia, because of regurgitation associated with the organs being compressed. And subsequent patellar luxation has been noticed in recovered swimmer puppies, which is just a result of them not having adequate muscle strength still, so their kneecaps can dislocate. This is a specific picture of a case. I believe it was a puppy given to a veterinary hospital by a breeder. The puppy was very underweight, I believe only 850 grams. And then this is the beginning x-ray. You can see the chest is very flat. And then on the x-ray, you can see the heart is kind of deviating to the left. And then after the treatment, which is, I believe it included a lot of the physical therapy that I mentioned before. You can see it's a lot more rounded, and then the heart is no longer deviating to the left. And then just the side note, so it's similar to a condition called myofibrillar hypoplasia in newborn piglets, and this is called splay leg. And this condition has been observed to be hereditary in pigs. They have done studies and identified the specific genes. And then while doing some research for this, I did also see a few cases of rabbits that had it, and then one was a snow leopard cub at the Bronx Zoo. And that's all.
There you go. Swimmer pups. Questions, comments, experiences? The prognosis is good if you can get them back up.
Right.
Yeah, that's terrible. There's a.
I work on a hog farm and we get piglets with splay leg and we just tape them and they usually recover themselves.
You tape them, okay.
I saw some pictures that I think they had made a specific device where it was something around their neck and kind of went along their back and attached to their feet, but similar to that.
Now you tape them together, the back legs together,
Yeah, you tape the back legs together
and they
you
can
brace
still
it.
go like this though, right?
Yes.
Yeah, so they can still, they're still mobile.
It's a little hard to see in this picture, but both
Okay.
legs are taped together.
Yeah, okay, trying to get you up like that.
Yeah. They really have trouble just getting their legs under
Oh, yeah.
them in the first place.
So that is a good remedy right there. Comments, questions, anything else? There's one more back here.
So, like, the name like myofibroplasia, does that just mean hypoplasia? Does that just mean like the muscle fibers in the legs are like
Yeah,
underdeveloped?
go back to that name, let's see. Okay,
Um,
that's in pigs though. No, it's not, it's probably not called that name in dogs, is it?
No,
Okay,
it's
yeah.
just called swimmer syndrome.
Well,
and
myo is muscle, so it's maybe muscle fiber. Hypoplasia means low growth, so it's something about low growth of the muscles there, I suspect.
So, for dogs that have swimmer syndrome, is it more of a neurological thing or is it more of like a muscle atrophy issue?
It's been thought to be both. They really haven't done a lot of research on it.
But if
I would
it
just-
recovers when you do this, that's more likely than muscle. You're just getting the muscles back. The nerve tract must be.
In the one study that found that it was more frequent in overweight dogs, I think it was because they had more trouble getting the
Yeah.
weight on top of their legs.
Yeah.
in the first place.
Yeah, if it's a small litter, then they get all that milk. They get chubby. Okay, excellent. We're moving on. Laura, come on up, find your presentation.